welcome everybody, where today we're going to talk about the CMS, the Centers for Medicare and Medicaid Services, the section on for the hospital conditions of participation on surgery, PACU, and anesthesia. It's a pleasure to be your speaker today. I also have, I think it's the only book out on the CMS anesthesia standards, so they're a particularly good thing. Okay, so on slide number 6, we have section numbers or tag numbers, and as I walk you through, I'll be showing you the tag number for each of these 3 sections, and then I'll show you how to get a copy of those. So first, they're published in the Federal Register, and when they're final, CMS comes along and adds interpretive guidelines. So we as hospitals will know what they are, and some of them, but not all of them, have a survey procedure. In slide number 7, the best way to keep up with changes in the future is to have 1 or 2 people at your hospital that can sign up to get the Federal Register, so in the future, when there are changes, you can see them. Also, to have someone go out once a month and check for the survey memos, although during COVID-19 we're suggesting you do it on a daily basis because the last 27 memos have all been on COVID-19. Again, this is June 30th of 2020, so we're still kind of in the midst of the COVID pandemic. And then if there's a new manual, check to see if there's a new manual. And if there is, then normally I will go to the transmittal. We'll show the red line changes and if any tag numbers have been deleted. On slide number 8, this is the website where you can sign up for the Federal Register. It is free, and you can. It used to cost us a lot of money, but now again it is free, and you just put your email in and hit submit. In slide number 9, this is the policy memo website, and this is the one I said that usually we check it, tell you to check it once a month, but during the COVID pandemic, maybe daily. And for some reason, when you get to this website, you have to double click on the little middle column that says posting date, and then it will bring you the most current ones that are up. On slide number 10, this is the survey memo website, and this is where all of the survey memos are located, and then all you do is scroll down and you can look for them by date, and if you want one, you just literally click on it. And on slide number 11, you can see where there have been a lot of different survey memos that have been issued over the last few years. And on slide number 12, so as I walk you through the section on surgery, PACU, and anesthesia, if you want to see the actual tag number or section number, all you do is go to this website, and this is a fairly new website. This website just came out in 2020. Then you would click on it, and it will take you to the most current manual. And then also, if you are in a system, today we're talking about, at the moment, Appendix A, but if you're in a system with a critical access hospital, then you have a different email address to ask questions. And while the surgery and PACU standards are very similar between hospitals and critical access hospitals, that is not true of the anesthesia standards. There are major differences between the anesthesia requirements of hospitals and those of critical access hospitals. So that is one of the few main areas where there are major differences. And on slide 13, whenever you click on A, it will always take you to the most current one, which is currently February the 21st of 2020. Now, this is considered 2020 the year of the nurse, so I've also deemed it the year of the CMS changes. And we had 2 laws that were a total of 600 pages of changes for hospitals. And so that's why I'm also deeming it the year of the change. And those interpretive guidelines and survey procedures, they said would be out late spring or early summer. Well, today's already June 30th of 2020, so we know it's not going to be late spring. But because of COVID-19, I would not be surprised if indeed they are delayed. So we do expect that this manual will be updated this year. On slide number 14, again, if you click on it, it brings you up the most current one, and the most current one for critical access hospitals under Appendix W. And when you click on them, they're C standards. You also see it was updated February the 21st of 2020. And we have 188 changes in the critical access hospital manual. Just a couple of important memos on safe injection practices, because we're giving lots of medications, especially their anesthesia providers. So there are 2 survey memos, and there's a section in the CMS worksheet. And so the bottom line is that if they make it in a single dose file, you have to buy it in a single dose file. If they don't make it in a single dose file, and they make it only in a multi-dose file, you'd want to use it on one patient and one patient only. If you want to take it into the OR, then you would need to have a policy that you would treat that multi-dose file as a single dose file, and then you would dispose of it at the end of the case. And CMS in the safe injection practices does mention some of the 797 guidelines, which they have now removed all references in 2020 to USP. Not because you don't have to follow them, because you do, but you might remember that they were going to make amendments to 797, and I was excited because the 1 hour beyond use date was going to go to 4 hours. So if you draw something up, you would have 4 hours. Well, it was appealed, so it was delayed, and then, of course, with the USP new 800 one. So what CMS did was they just removed it, so that way every time they make changes to USP, guidelines 795, 797, 800, whatever, then they don't have to keep going back and changing the manual. So instead, they just said you have to follow standards of care and standards of practice. And this is what that survey memo looked like. And again, they'll cite you under infection control if you're not following these safe injection practices. And we've had 3 major studies that have shown that we really have a deficit of this, that a lot of people are actually getting it wrong. And so again, the bottom line is you can't use a single dose vial on more than one patient, that they don't have a preservative. And once the vial is opened, it can grow bugs. On slide number 20, so again, if they make it in a single dose, you need to buy it in a single dose. And if it's a multi-dose and you open it up, then you need to date it. Usually it's 28 days from the date that you open it, unless sooner by the manufacturer. And even though that's a new vial, you need to clean off the top of that. On slide number 21, I used to go around and post up a new safe injection practice poster when I was at the hospital, in the med rooms and in the physician lounges every 3 months. So there's quite a few of them out there, but 1 needle, 1 syringe every time to get 0 infections. And then CMS says that you have to follow standards of care and standards of practice. And they specifically mention the Institute for Safe Medication Practices at ismp.org. And ISMP has 26 pages of IV push guidelines. And one of the reasons why they created the infection control worksheet, which has it in here, was something that happened actually in the state of Nevada. And in Nevada, there was a GI doctor who owned a couple of outpatient clinics, and he would do epiendoscopies and mostly colonoscopies. And he wanted to save money by reusing syringes. So he took a multi-dose vial. Now remember, since this has occurred, you can't use multi-dose vials on more than 1 patient. So if this were the case now, it wouldn't happen. But what happened is he took the CRNA, opened up a new vial, cleaned it off, clean needle, clean syringe, injected the 2 cc's into the patient. Well, this particular patient has hepatitis, and so even if I'm pushing it in, it's not a one-way street. And if there's some reflux even back into the syringe, that syringe is contaminated with hepatitis C. Then the patient needed 2 more cc's, so the CRNA took off the dirty needle, put on a clean needle, but he's using the contaminated syringe. And so even though he's pulling back 2 cc's, there could be some reflux of a solution in the syringe into the vial, and if so, that vial is now tainted. So the next patient, even though you use a clean needle, clean syringe, it doesn't matter. That vial is now tainted. So that is why we can't use multi-dose vials on multiple patients. So on slide 24, again, this is free at ismp.org. You want to provide IV medicine the most readily administered form. You either, for flushes, you either have to buy them from the manufacturer or the pharmacy has to do it. Again, if they make it in a single dose, you need to buy it in a single dose, hand hygiene. Again, even if it's a new vial, you clean off the top. Medication should only be diluted if the manufacturer says so, or you have an evidence-based hospital policy. If you're using medicine from a glass ampule, we use a filter needle unless the drug precludes